as well too. And then we will get started here. So super excited for you guys. I will explain first so that Gordon understands this group of people, because this is our elite group within our team that we set out a challenge for them every single month to acquire at least 2 new people and 100 in new volume to qualify for the Performance Club. And we have people on here who have done it month after month. We have people on here that have done it for the first time this past month, but it's just an opportunity for us to celebrate our team that is doing the right behaviors and putting the right things into motion. So Michelle, she thought it was an awesome idea to bring you on board so that we could just kind of highlight everything that you do with LifeVantage, because you play an absolute crucial role.
Yes.
And I know that not a lot of people understand the importance of the work that you do, but it is something that we truly get asked about a lot by people who are interested in LifeVantage. So Gordon is in charge of quality assurance and quality control with LifeVantage. So I think Dorothy, we had a little.
There we go.
No, we're good. Okay.
I think we're good now.
But yeah, he runs the quality assurance, quality control. So I'm going to turn it over to Gordon just to talk, kind of update you guys on what they do, how they do it, all of those good details. And then at the end, if you guys have some questions and we have a little bit of time, we'd love to open it up for a little bit of Q&A as well too.
Great. Can you guys hear me okay?
Yay, we can totally hear you. Wonderful.
Okay, great. So 2 really great things. First of all, I'm actually broadcasting from our new office in Lehigh, and it's beautiful. And this is the 3rd time I've sat in my office. And so
wow.
I'm used to the monitors. So as I'm looking at you here, this is a blank screen. And I can see it projected over on this other screen. So pardon me if I'm a little bit awkward, but I'm just going to stare into the monitor and know that you guys can see me. But we are in this brand new office, and it's so pretty. It's beautiful. Second thing is, this is kind of an anniversary for me. The 15th was 9-year anniversary with LifeVantage.
Nice.
Yay! 9 years. Let me quickly introduce myself, and I'm going to go through our quality system pretty quickly because I just want to make sure that I leave enough time for question and answers because I think there's never enough access to me and the ability for you to ask questions. So really quickly, like I said, I've been with the company for 9 years. My bachelor's degree in food science and nutrition and a master's degree, an MBA. And I've been in the nutritional supplement industry since 95 and worked for many of the major companies here in Utah. I am the Vice President of Quality Assurance and Regulatory Affairs. The regulatory affairs side is the product registration in different markets. And making sure that the international labeling complies and that we make claims that are appropriate and things like that. LifeVantage, we are really proud of what we do here and really proud of the systems that we've created because there's a misconception in the country that nutritional supplements are an unregulated industry, and it's not true. There are laws in the Code of Federal Regulation that govern us, and if we have any problems, the FDA can and will shut us down. We are regulated by the FDA, and they do come in and audit us. We did have an audit about 3 years ago, and we passed with flying colors.
Woo, thanks to you.
So, yes, thank you. Yay, Team LifeVantage. So we do have regulations and we do have to follow them. And that's really what my job is to make sure everybody's doing things correctly. And within those those regulations are good manufacturing practices. And we really go above and beyond, and I'm going to give you a few examples. We are the last people that we see product, we test product, and when we click that button, it goes to you. So we are that last line that we make sure that that product is safe and effective. And we do this by a physical inspection where we'll go and we'll make sure that the labels are correct and this correct product and correct bottle and the inkjet looks good. But we also run this whole barrage of tests. We run micro, pesticide, herbicide, heavy metals. Depending on what the actives are, we will test for all of the actives. We test for banned substances. We test for a lot of different things. And all of those tests have to come back and they have to pass in flying colors, and then we release product. It's expensive to do that. And in our industry, it's acceptable to qualify a manufacturer, which means you test everything. And then once you're comfortable with them, you can go to statistical sampling, which means you test maybe every 5th lot or every 10th lot if you have a bunch of them. And at LifeVantage, we determined that that statistically this wasn't good enough for us. It didn't meet our standards of quality, because if we're testing, say we're testing every 5th lot, that still means 80% of the product is going through without being tested. We determined a long time ago that we're going to test every product. So when I rattle off all this really scientific sounding testing, know that we test it every time for every lot. So every time we have a lot of Protandim, Nerf 2, Nerf 1, NAD, Axio, it doesn't matter. We do all the testing every time because we want to make sure every lot of product is good. Because we do this, because our manufacturers know we do this, we never have problems. And so that's really above and beyond. And like I said, it's expensive, but we don't like the statistical sampling idea. There's a 95% chance that there won't be a problem based on blah blah blah, right? Like if we can test it, then we do. Something else, and this is actually a really fun part of one of the fun parts of what I do, is auditing. So we work with contract manufacturers, we buy raw materials, we work with contract laboratories, we work with warehouses all over the place. And we get the opportunity to go and to make sure that they're doing everything that they're supposed to be doing, because everybody, when you get a bottle of product, there's a lot of people that went into the quality of that product. And that includes manufacturers, warehouses, and so forth. And we literally go to every one of these facilities. I and my team and the operations team, I got to put a plug in for ops because we're really in lockstep with the operations team. And we go to China, we go to India, where they're bringing in raw herbs out of the fields, and they're processing, and they're going from good farming practices through to good manufacturing practices for nutritional supplements. So it's an increasing level of sterility and quality in manufacturing. And we go to foreign countries. I've had the chance to go to France on the Mediterranean in France and to audit there, and I do not mind doing that. It's wonderful, and it's wonderful because we get to see the entire food chain and be really assured of the quality, and we get to meet people from all over the world and experience different cultures. But it's also a little bit expensive to do that. But again, we want to make sure that not just like we're testing and making sure that the quality of the product is good, but early on, in the making of the actual raw materials that that the processing is all done correctly. And in the regulations, they of course require us to audit manufacturers, but it's really like we have to audit the people we deal directly with. Makes sense. And then they audit the people they deal directly with, and so it creates this food chain. And we actually jump over that and jump over that and jump over that to where, you know, we audit U.S. distributors for materials, and then we go with them to foreign countries, and then we audit their suppliers. So we've really locked arms with everybody in our supply chain, manufacturing, raw material, warehousing, laboratories. We audit laboratories, and so we're really confident in our systems, the quality of the product, and we go above and beyond what the minimum requirements are. Like I said, we did have the FDA come in, and it's a little bit intimidating when somebody from the government walks into your facility in a uniform and shows their badge and says, "All right, we're going to be here for the next 3 days, and I want to see all this documentation." You know, you get on the phone, you're like, "The FDA is here. We need somebody out here to help."
And do they come unannounced?
Oh yeah. They, and they did tell us they'll come every 3 years. But and incidentally, that is the first time I've ever been audited by the FDA. The burden of that has been for a long time on manufacturing facilities. And the FDA has long threatened that they will contact marketing companies, and we still play a very important role, and we have a lot of documentation, a lot of testing, and it went pretty well. And with that, I feel like I've been talking super fast, and maybe I'll just open that up for any questions.
Perfect. You guys all can unmute. So if you have a burning question right now, I see Mia's got her hand raised. Let's hear it.
So, good. Thank you so much for this. There's some feedback. Is that okay? Sounds like there's some echo, but my question is, thank you. How have you been able to go to those other countries, or have you, for that oversight during this pandemic?
Well, we haven't, is the short answer. Also, we, in our systems, there is a priority. The manufacturers that are actually making the product, we go and visit all of them every year. Raw material suppliers, we go every 2 years. International suppliers, it's every 3 or 4 years. So I personally have been to these manufacturing facilities at least 3 times. And so these are the types of facilities where they're doing the same things over and over again, and there isn't a lot of like new equipment, new facilities. I'm sorry, I'm like talking to you here and looking at you over here.
All good.
You're good.
Okay.
When we go over there, we pull out our notes from the previous audit, and it really helps us target when we go in there, because we've been there several times. With COVID, we have not been allowed to travel, and especially international travel. But with our schedule, it's still going to be fine. And I'm kind of assuming that things will open up in the next 4, 5, 6 months, and then we can resume some of those. We have been doing all of our domestic audits that I said we do every year. We've still been doing them, and we've been doing them via Zoom calls. And just like we're doing here, because we've walked through the facilities, we already know that. We sit down, we go through their processes. We have them send to us their written procedures, the documentation, their testing. So we're doing it via Zoom for quarantine, but we are still doing our domestic auditing and just holding off on the international. But like I said, I personally have been to all of them at least 3 or 4 times.
Nice.
I thank you. I should know this, but everything is, even though products are international, is everything sourced here?
So that's a trick question, because everything we buy is in the U.S. And I might be lying, because like some of our bottles may come from China, but I just don't know. But as far as the materials that go into all of the cosmetics and the nutritional products, they're purchased from U.S. entities. But the fact is, I always get questioned. Everybody's concerned naturally, because products are coming from China, they're coming from India, and everybody's wanting to know, like, well, are Chinese products, is that a problem? Is there a problem with quality? I have several answers to that. And the first one is, if you're looking at turmeric and ashwagandha and bacopa, they're indigenous to India. They are part of Ayurvedic traditional medicine, the Indian medicine, and they're indigenous to India. That's where they come from. So if you want turmeric and if you want ashwagandha, that's where it's grown from. And things like milk thistle and green tea, like they're indigenous there. So it's not like, well, I don't like Chinese made materials, so I'll get it from Canada or from like there is some discretionary things. Like, for instance, if you're getting some sort of a grape or a red wine extract or something, Napa Valley will tell you that theirs is just as good as France. But for the most part, you're having to get things from where they're grown. With that said, and having been to many of these facilities, they're state of the art, and they are full clean rooms. If you've ever watched, this is a bad example, but this is what comes to mind. So you guys, this is live. This is happening right now. So if you watch the original Willy Wonka, because I'm a huge Gene Wilder fan, where Mike TV, and they go in there and they beam him through, and they're in like the suits, it's like comes over the head and all the way down, and gloves, and the room is white. Like, that's really what it's like. Add a bunch of big stainless steel equipment, and add a bunch of dust from like herb and stuff from being blended and stuff. But that's really what it's like. The facilities are all state of the art.
Great.
Answer your question more.
Thank you.
May I ask a question?
Yes, Don.
Yeah, I have a question. Can you talk for a moment about the significance that we are FDA regulated and audited? Because, when we're speaking with some people, when we're sharing this, at least I say, we're not FDA approved, but we are FDA regulated. Can you talk about the power and significance of that? Like additional things we can say to people that show how critical it is that we are FDA regulated.
Am I muting myself?
There we go.
There we go.
Because I don't know if you guys are muting me, but I look down and it's got the little X through the mic.
I just muted it because when Don was talking, there was a bunch of feedback.
I get the feedback. Yes, I get the feedback.
Yep.
I am so glad you asked that question.
Great question.
Because this is both my quality assurance and my regulatory hat, and it comes up a lot. So in the United States, we have the Dietary Supplement Health Education Act, DSHEA, and it was passed into law in 1994 and then implemented in 1997. And what it did was it created a category called nutritional supplements, and it created GMPs. And prior to then, we didn't have these supplement facts panels. We had nutrition facts panels for foods, but they weren't sure how are we going to label this. What kind of claims can you make? What are the good manufacturing practices? All of this stuff, right? So when DSHEA was passed, it is what's known as a post-market surveillance, which means there isn't a formal registration in which we have to fill out a bunch of paperwork, submit it to the FDA, and then we get a piece of paper that says the FDA approves of you doing this. Post-market means the laws are there and we are legally obligated to follow all of those laws and regulation. And if and when we do, we can go ahead and market our product. And if we're doing something wrong, the FDA monitors the industry and then goes after bad players. There is, however, a notification that is submitted for marketing claims. And so we send something to the FDA that says, here's our product and here's a copy of the label and here's what we're going to say about it. And no news is good news. So we do have a notification that goes to the FDA for our marketing, and I do that. In most countries of the world, nutritional supplements are regulated the same way. They're post-market. So for instance, because nutritional supplements are a subsection of foods. So if Stouffer's is coming out with a new lean cuisine, they're not getting FDA registration in order to do that, but they still have to follow all good manufacturing practices to make sure their product is safe and tastes good. And then if there's a problem, the FDA will come around and audit them and so forth. So if you think of it that way, nutritional supplements are the same way. And when we go into different markets, it's the same. We partner with consultants who are industry experts in those countries, and we say, here are all of our ingredients, and they say these will go in, these won't go in, and we find formulas. So that's why sometimes formulas are a little bit different in other countries. It's because that's their regulation. And so they will help us get a product in, make sure that the label complies, and then we launch the product and we don't hear anything because we put a lot of effort into making sure that we comply. So we are regulated by the FDA. You will hear people say that it's not regulated, that the FDA doesn't approve of that. That's a pharmaceutical way to talk, because if you come out with even an OTC, you're going to come out with an ibuprofen. There is still an OTC registration for that product, and FDA approval. But again, that's pharmaceutical, and it's not for foods, right? If I'm going to come out with a new jelly for my toast, I don't have to get it pre-approved, but there are standards of identity of what jelly is versus jam, and I have to follow all of those. There are only 2 countries that categorize nutritional supplements as, and I'll probably stop after this. I may go on this subject too long, sorry. There are only 2 countries that regulate these as OTC pharmaceuticals. They're drugs, over-the-counter drugs, and that's Australia and Canada. And so we actually have to meet a drug monograph in those 2 countries and go through an approval process. In Australia, it's through the TGA, and our products are listed medicines. And if you happen to see a bottle from Australia, it'll say Austell on the front, and it'll have a number, and that's their government registration for that product. And it's the same with Canada, because Canada followed Australia's regulations probably 10, 15 years ago on their OTCs. And there is, I think it's an NPM, natural product number, which is their drug reference number. So NRF2 is a drug in Canada and Australia, and it's the same product. It's all just a question of complying with the regulations. That was a long answer. It was fun. Hope you guys liked that answer. That was great.
Well, thank you.
Great question, Don. Let's see, Janet.
had it.
Janet's up from Canada, so she was like probably.
Hi, Janet.
Hey, so this is good. This is really good to help us understand why some things are not allowed here, but that's very interesting about the NRF2 being classified as a drug here. That's
Yeah.
very interesting. Some insurance companies allow NPM products to be paid on the people's medical benefit
Mhm.
packages and stuff.
Mhm.
But my big question is about the Axio. So many, like, we are only allowed the red raspberry here in Canada.
Mhm.
And, you know, it blows me away that companies like Red Bull and Monster drinks and all those energy drinks can be put into drugstores and on the shelves in super, markets and all that. But we can't have Axio that has really healthy products in it, healthy ingredients.
Right. Yeah. So
So
go ahead.
what was the red flag? What is the biggest red flag that doesn't allow the regular Axios to come?
Did you get that, Gordon? I think she's just wondering why caffeinated.
Sort of.
Yeah.
Yes.
That's
Yeah.
a better question.
So let me give you multiple answers to that. In the US, there are some ingredients that could be in a supplement or in a food. Take vitamin C. It could be naturally in your orange juice. It can be fortified with vitamin C, or you could take a vitamin C supplement. But there are other nutritional supplement ingredients like ashwagandha, for instance. Ashwagandha is perfectly acceptable in supplements, but it is not allowed in foods because it's not grass, generally recognized. And so you won't see foods with ashwagandha. In Canada, you have products like, and it's the same in the US, you have products that have a bunch of caffeine and maybe they've got some vitamins and some taurine or something in it. And those are all accepted as food ingredients. And I don't know off the top of my head which ingredient it was that is the problem in Axio, maybe the DMAE, but it's more complicated than Red Bull. And so then there is some ingredient in there that isn't allowed for whatever reason. I'd have to look and find out specifically what that is, but
I guess you're right with DMAE because it is not in the decaffeinated versions.
Yeah.
Right. So that's probably what the issue is. If you look at the U.S. Nerf 2 and the Japanese Nerf 2, when we first went into Japan, when I first started, they wouldn't allow it's ashwagandha. Ashwagandha. So if you look at the Japanese formula, it has the black pepper in it, and it does not have ashwagandha, and it's just because they consider it a pharmaceutical in their country, and so we couldn't put it in. It does make it a little bit difficult because as we're growing, we understand your frustration that we tend to be U.S. centric, right? All the products are in the U.S. and other countries are like the Canadians. Bless your hearts, you guys are just like every EA. You're like, when am I going to get Pet Tandem up there? Which is a whole nother story. But it is just regulations. You guys don't have a pet supplement category, and it's either pet food or pet medicine. And so it really does come down to just meeting the regulations for what's allowed as a food, what's allowed as a supplement in your markets. But we are trying to work on a global Axio that will expand that for not just Canada, but for many other markets.
Very cool.
Amazing.
I think Dorothy and
Lisa.
Lisa. Dorothy.
I just have, it's kind of on the same vein, so I won't beat this to death, but there is something that I get major reaction to. And it's kind of funny, but you know, when all the body products came out, some of them can't come up, a lot of them can't come up to Canada because they have CBD in them. The reaction I get from the people in Canada is like, pardon? I mean, it's like marijuana is like nationwide approved, and CBD is all over the place. And you've got all kinds of little marijuana smoke shops with selling CBD, like right next to the drugstore, the liquor store. And people just laugh. They're going, "Well, you can't come in because of that." Is it something more than that? I don't know.
Sorry, I had to mute him again, so he has to mute himself. There we go.
If you mute me, do I have to unmute me?
Yeah, sorry. We're trying
yeah,
to.
Yeah, CBDs. Now, if I remember correctly, for Canada, CBD is allowed in cosmetics. It probably is also allowed in ingestibles. But the problem is the way it's regulated had to be from Canada approved farms. And we're sourcing it from the US. So right now it's a hurdle that we're having to jump through. And you know, we're trying our best to get international versions everywhere it will go. But I'm off the top of my head, I'm pretty sure that one of the issues because CBD is legal in Canada, and that's right, you will see it probably on every corner, right? But it does have to do with the sourcing of the materials. So we'll work on that one. Stay tuned.
That's it's fascinating though. That makes sense.
It's also just as an aside, for cosmetics, many countries will allow hemp seed oil in cosmetics. The problem with that is hemp seed oil doesn't really have CBDs. That comes from stalk and stem, and that is a novel ingredient in cosmetics in many countries, which is one of the reasons that we're having either difficulties or it's having a slow time finding formulations that will go into other countries. And, here in the US, it's only been recent with the passing of the Farm Bill that it's really legalized hemp products, so non-THC. And that opened the way for banks, because if you're like a mom and pop shop in a corner, you can do a lot more because you're taking cash or cards. But if you're a nationwide company or an international company like us, you have to have banking systems so that you can take payment for these types of products. And up until recently, banks wouldn't do that. So we're trying to find payment methods in other markets that will allow the sale of these types of goods. So it's actually a really complicated thing. I think socially it's becoming more acceptable, and legally, the problem is there's still too much of an association with marijuana. So those things need to be separated, and a lot of this mess will be cleared up.
Thank you.
Thank you. So good.
Lisa
Weiland.
Hi there. Thank you so much. I have a couple questions. And the first one is, I'm coming from a medical realm. And so when you were talking about the FDA audit, and I just want to understand this. So in order for our hospitals to practice, we have Joint Commission coming in, and they come in and they're looking at practices, and then they give regulations and recommendations, and then we have so many weeks or whatever to work on those and then oh, there you are, Gordon. I lost you on the screen. And so is that similar with the FDA when they're coming in to audit LifeVantage? They're saying, oh, we want you to work on this, this, and this, and then you have so much time, and they come back and look at it. And if so, what are the things that they want the LifeVantage to work on? And then the second question I have, it has to do with, of course, organic and California standards of practice. When my clients ask, are you organic? Do you have the California standards? So those are my two questions.
And sorry, Gordon, we had to mute you again.
Okay, there we go. Those are two very big questions. And so I will talk fast and try and answer them both adequately. The first one is like, what is the FDA looking for when they audit us? It is less about like they're coming in, they're finding things, they're working with us. They're expecting us to already be up to speed. So the FDA will put out, if you go into Google and you type in 21 CFR, then you're going to find all kinds of regulations about stuff, all sorts of things. And within that, there will be GMPs for manufacturing nutritional supplements. And the GMPs say something like, you must have a quality assurance department, and it must be independent of operations, and they must issue documentation, they must review documentation, they must sign off on all blah, 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 right? And so then they'll look to see, do we have a QA department? Are we issuing documents? Do we have document control? Do we have written procedures? If we have written procedures, they'll read the procedure and then they'll want evidence that we're following that. So they want us, they expect us to have specifications for our products and then show that we are testing and showing compliance with those specifications. They look to see our audit documents. They look to make sure that we have traceability, which we do, that if there is a problem with one raw material, I can tell you everything that it went into. Or if there's a problem with one finished product, I have to tell you everything, the entire food chain that went into that, right? So I can run, if you give me a any particular product, I can look at the lot number on that. I can have the IT department run a report, and they're going to tell me every one of you who bought that particular lot. And the FDA checks those types of things. They wanted to see that we have retention samples for testing. They wanted to see that we have, boy, a lot of stuff. It's been a few years. And I just keep, in my head, because we had to show them 3 lots of Protandim, and we have testing for each one of the raw materials that went into it. So, the documentation for those 3 samples was literally like 4 or 5 inches thick. And I got so satisfaction of walking in and just like, boom, dropping that on the table and say, okay, go through it. But they're really looking for making sure that we have specifications, that we're following specifications, that we have written procedures. We have to have, they wanted to make sure that we had a complaint process and that we're reporting adverse events. They wanted to make sure that we were submitting our notifications. They wanted to make sure we're auditing all of the manufacturers, and we had to demonstrate, we had to provide documentation. That answer the first question? The second question was, California. So just to be clear, I am from California, so if I badmouth California a little bit, I have leeway to do so.
Yes.
Because California is the tail wagging the dog. We have Prop 65, which covers chemicals in everything I had a friend of mine that took her family to Disneyland and took a picture and sent it to me. And there was a little sign getting on one of the rides that said, warning, the state of California has determined that something to do with this ride, equipment, or causes cancer to blah, blah, blah. And it's this little sign getting on a ride for Disneyland.
Jeez.
And so Prop 65 hits us because we have to comply with limits for heavy metals. And we don't differentiate. We don't have a SKU of product that goes just to California and another SKU of product that goes everywhere else. And so complying with Prop 65 means we have to do that for everywhere in the United States. There are different compendial reference. Compendium meaning like there's the USP, the US Pharmacopoeia, there's the British Pharmacopoeia, there's the German DAC, and these are references that say this herb, this vitamin, this protein, this is what it looks like, this is the standard of identity, this is how you test it, blah, blah, blah. This is the limit, like there's USP limits for heavy metals and herbicides and things like that. Prop 65 is much more strict. And so we have to comply with Prop 65 for heavy metals. We also use CDFA is, don't you love it when you get somebody on and they just like spout off a bunch of acronyms like they're in the military?
Yes, we do.
I got to stop and think about it. What does CDFA stand for? The Department of Food and Agriculture. And that is for herbicides and pesticides. And it's much more extensive than USP, and it's much stricter limits. We comply with that also. So we do comply with California regulations. When you're talking about organic, that is still a work in progress. And I don't mean just for LifeVantage, I really mean for everywhere. Because the certifying bodies are still growing and developing. And some products, if you grow and harvest something and your formulation for whatever that is, maybe it's bread, right? And you've got local growers for your wheat and things like that. Getting an organic certification and getting a body that can do that is much more doable. When you're talking about international supply chains, and you're getting turmeric from India, and it's the same turmeric that may be going into all of your spices that you see, the McCormick and everything else in the spice rack. And if you stop and think about, in order to be organic, you have to know the history of the dirt that it was grown in, what was grown in. You have to know what seed. You have to know the fields that were grown around it. And you have to be able to follow that through the entire supply chain. Don't get me wrong, like that is this gold standard that we want and that we will work to achieve. It's going to take a while for those types of things to mature, simply because I don't know what body is going to fly all over the world and then certify these different raw materials and then have some sort of an approved list of where you can get organic Bacopa from. So really the next best thing is the level of testing that we do to make sure that there are no pesticides, no herbicides, no heavy metals. And the thing is, like genetically modified isn't really much of a factor in what we do, because the herbs that we're working with, there's major commodities in the United States that are genetically modified: corn, soy, which I think there are statistics saying there's GMO corn and soy in probably 70% of our food supply in the United States. But there are the big 5 or 7 or 9 commodities that are heavily genetically modified, but just not herbs. Like green tea is not genetically modified. They haven't really done that kind of a thing. So GMO isn't. We actually do require certificates from all of our suppliers that say the product is non-GMO, and we need to know things that are involved in the allergens because we're legally obligated to report those. We need to know allergens. We need to know gluten. Anyway, we get as much of that data as we can, and we test to make sure that it's clean. And we will continuously improve. As those systems get better and more available for companies like us, we will certainly take advantage of those.
Amazing. Tanya Sheldon, and then Gordon. I know we'll let you get going. Tanya.
Hey, Gordon, I'll go first. I may have to jump off in the middle of your answer, but first and foremost, thank you to you and your team for having our backs and giving us the confidence to go out and do what we get to do every single day, and that's share what we have. So my hat off to you.
Yes.
And your team for that, first and foremost. And secondly, mine's more of a supply chain question. I know a lot of other industries out there are really suffering with a backlog and a backlash from the pandemic with, getting raw materials and getting lumber and getting bottles and getting just anything. And if you could just share, if you can share, how far LifeVantage is out in front of that, and what it may do to our industry, because there's a lot of industries out there. You just can't get bike parts, you can't get car parts, you just can't get any of this stuff. So if you could speak to that.
My question's easy. You've been in the nutritional supplement industry for such a long time. I just want to know why you love LifeVantage so much and why you're here.
Wow. Okay. Okay. Let me give you a couple of quick answers before you jump off. First of all, I do love my job and I am proud of what we do, and I am a consumer of the products, and I do take the products home to my family. So it's not just like my job is to make sure of this. Like I also, you can hear my California coming out in me, can't you? Because I keep saying too much. So my family does consume these products. So as far as supply chain, I report to Chuck Walk, who is the COO, and we have a meeting every week. And Jason Wright is phenomenal. He's the director over operations, and they keep their thumb on the pulse of raw materials that are coming in and what is happening with the supply chain. Because it's not just availability of materials. Sometimes it's actually trucking, shipping, flying the materials in. There have been a couple of times where in a meeting, the operations team has said, we have some concern about a particular material. So we went ahead and bought several months worth and then stocked extra material. They've done a phenomenal job. And so far we haven't really, I think our biggest problem, I'm speaking a little bit out of school here. Our biggest problem has been with some of our packaging. We probably had more problems making sure we have consistent packaging, but we've always managed to work it out. That was your question, right? Was there a follow-up? Did I answer your question first?
Thumbs up.
Why you love LifeVantage so much?
Yeah.
No. I wanted to make sure I answered the first question adequately.
Yeah,
Kyle, are you good?
Okay.
that's
Okay.
perfect.
Good.
Absolutely
So,
perfect. I just, buying
so
it, getting out in front of that is good information. So thank you.
Yeah. So why LifeVantage? I was at another company. I actually knew several people that were working at LifeVantage. It was right at that point where we're kind of catching a gear and it was starting to grow. This was May of 2012. And there were a couple of things that really attracted me to the company. One is the fact that it's publicly traded. And I, as an employee, love the fact that there is oversight into our finances, that it's a business that the way that we're audited, our finances are audited. And so I love the transparency. There are no secret positions in the tree that executives have that are auto qualified, right?
Yes.
We MLMs, and that's what happens. And I love the fact that it was publicly traded. That was a big draw for me. Additionally, because as an employee, I wanted to make sure that there was going to be longevity of the company, and that gave me some insight into that. I was super intrigued with Dr. McCord and the Biophotonic. No, that was another company. I forgot what his test is called. You put me on the spot. The
Oxidative stress
The
or
T-bar?
T-bar testing,
no. It's
superoxide dismutase.
no. Those are what he was testing for, and
Yeah.
the
Nutrigenomics.
No. Stop! You guys are confusing me.
I'm sorry.
There's a specific test that Dr. McCord was doing on Nerf2 that was determining that you could actually measure the Nerf2 response. As I was looking into the company, like I went out to Denver and worked with Dr. McCord as part of my job, and worked with his team out there. And they had this really cool cells that they could grow in these cultures, and they could put things into the environment of the cell, and the cell responds to those things in its environment, and it triggers this Nerf2 response, and the cells produce these antioxidants, superoxide dismutase, catalase, and then there is a gene splice into the cell from a firefly that then luminesces when this chemical process happens. And then there's a detector on top of that that's measuring the amount of light, the amount of lumens coming off of it. So what that means is you can put Nerf2, you can put different ingredients in with this cell, and it'll turn on or not turn on that Nerf2 response. It's driving me crazy. I can't remember what its testing is called. That's shameful.
I totally remember that now.
But anyway, so it actually measures the efficacy, and that's really how Dr. McCord came out with the product. He took these cells and put all kinds of different things, and then started seeing responses, then put different combinations, and then tweaking the combinations to get the best Nerf response. So this light measurement is measuring the output of the cell for turning on antioxidants. And that's brilliant, because having been in the industry for a long time, like being able to measure cause and effect in your nutritional supplement is a rare thing. So personally, and I'm a little more of the science guy, and so I geek out that way, but I was super impressed with the testing that went into it, but also that ability for us to demonstrate that we're not just like looking through a bunch of papers on turmeric and saying, maybe it does something, and then using that as substantiation. We're actually measuring it. Geez, it's gonna bug me what the name of the testing was. Don't tell Dr. McCord I forgot it.
It'll hit you.
Also, I've got to say one more thing, and that is, I report to Chuck, and the testing that we do and the auditing and the traveling is expensive, and I know I've said that 4 or 5 times, but as a company, I get a lot of support for that, and I never run into like we're just doing, our fiscal year goes from July 1st to June 30th, whenever. And so we're looking at budgets for next year. I never get pressured on, Gordon, why are you spending so much on your testing, right? I never have that. And I appreciate that kind of a support for my job. it means that as a company, we really put our money where our mouth is. And so when I stand here in the Zoom call and I'm telling you, we're really great, and we do all this testing, and it's not just marketing. Not that marketing is bad. Like it's the real deal. I do this testing. I go and I physically audit U.S. facilities and international facilities, and it vibes with my integrity.
I love it. I love it. I love
That's
it.
amazing.
Was this not awesome, you guys?
Yeah.
Great. Thank you so much.
We got lots.
I can only see like 6 people across the top of my screen.
Well, they are all applauding and saying thank you. So thank you so much for taking time away from your day to bless us and educate us.
My
on
pleasure.
this.
Well, and I would just say, I just remember listening to you. It's been some years ago when you had presented, I think, at an elite meeting and whatnot. And I just remember going, oh my God. You know, like we are so proud, you guys, right? Of our science. We're so proud of our, you know, like you said, Gordon, being publicly traded, the transparency. We are so proud of our culture and the people that LifeVantage attracts. But then I just remember sitting there listening and going, are you kidding me? Like the standards that he mentioned at the very beginning go above and beyond what the FDA requires, way above. And we talked about that at our last elite retreat when we broke out into different groups, you know, sustainability and like all these different things. And just to hear that, it just made me even more bulletproof. So we hope and pray, you guys, that you take this information back to your teams and really let them know what Gordon is doing, how long he's been here, why he's so proud, but you know, what really goes into these lots and the testing and the herbicides and the fungicides and the GM, I mean, all the stuff, and just being so dang proud. And don't just bring it back to your teams. Let people know when you are in meetings what we've got, because this is important information that I personally don't think is talked about enough. And so when we were brainstorming, like, who could we bring in to really bless the team with some new, exciting information? My brain was just like, oh my goodness. We were talking, we're like, oh, Gordon for the win, Gordon for the win, that guy right there. So I'm going to unmute you, but we'll let you go. You were so gracious, Gordon, with your time tonight. My gosh, an hour of your time to bless us. And we will make sure that this information does get out. And we just sincerely appreciate you. And we thank God for you and for everything that you give to LifeVantage. And honestly, I mean, the world, everything that you're doing is a huge part. It does not go unnoticed. So thank you so much.
Oh, thank you guys. You're great and so good for my self-esteem. I could just talk great about me after work every day. And just as a plug, when all this quarantine and COVID stuff is over and we can actually have meetings, you know, we do, like, I'm in the stores. So I'm usually in the Pro Tandem booth. You can just walk right up and hang out and we can chat about whatever. It doesn't have to be product. It could be like how cool Utah is, but yeah.
And the big, like, he's a huge athlete and does all these other things, you guys. So cool.
All right. Well, thank you so much for blessing everybody, and you guys all have an amazing night. And we
Thank you.
Thank you, Gordon.
Thank you.
Awesome.
Bye, everybody.
Appreciate you.